And the Labour Department is set to conduct a follow-up inspection at Frere Hospital in East London in the Eastern Cape. This follows last night's meeting between the department's Minister Thulas Nxesi, the Health Minister Dr. Zweli Mkhize and Eastern Cape Premier Oscar Mabuyane. The meeting was informed by a decision to close down Frere Hospital after it had failed to meet the health and safety standards, according to the Labour Department. Our reporter Yanga Funani is in East London with the Premier of the province, Premier Mabuyane. What does the Premier have to say this morning, Yanga?
A very good morning to you, Desiree, and to the scores upon scores of our viewers. Indeed, you are coming to us in East London, where a moment after, in fact, hours after a meeting which was held yesterday online with the Premier of the province and the Health Minister, together with Thulas Nxesi, who is the Labour Minister. On top of the agenda in that meeting was the closure of Frere Hospital. One will remember that health inspectors visited the hospital and found that it was not COVID-19 fit. But to tell us more about this meeting, we are now joined by the Premier of the province, Mr. Oscar Mabuyane. Dear, good morning, sir, and thank you very much for joining us. Tell us what transpired from that meeting.
Good morning to you first and to your colleagues at the studio, and good morning to viewers at home. The meeting went well. It was quite productive in tackling the issues that were before us. It's a meeting that together with the Minister of Labour and Employment, we have agreed that we must convene as a matter of urgency because of an issue that almost was worrying to us in terms of its public interest, and to what extent that decision will go in affecting the ordinary people in that particular hospital. Looking at it in terms of our internal processes in the provincial administration, we found that there appears to have been a communication breakdown between the inspectors as well as the hospital management, the CEO and the team. We felt that let's bring them together back again, and then the decision was that let's move out of court. There's no need for government to take each other to court when issues can still be tackled. Department has an executive authority, and also the province in the form of the Premier has an executing authority as well. We thought we are capable enough to find a solution amicable around that without undermining laws that are there, without questioning issues of compliance. Health must comply fully with all what is expected. We're dealing with a very emotional and a very sensitive issue on this COVID-19. So it is important that we don't leave any issues hanging around there, the safety of people who are working there. Because all these committees are in place, the occupational health and safety committees are in the hospital to definitely look around this and ensure that there is this ongoing monitoring and evaluation, so to speak. So we have done that meeting, and that meeting has actually showed a very clear way forward. We were just providing leadership, and with all the DGs and HODs of the department together with the MEC. As I'm speaking, the Department of Health has withdrawn its intention to interdict that. The inspectors are brought back to the site to actually continue with their work. All the issues that were raised were just low-hanging issues, the issues of triaging centers and minor compliance issues that would have been fixed within the day. So where I'm standing, I've been assured as a Premier that those things that have been done have been fixed, and it's unfortunate that there was just a lack of cooperation between the inspectors as well as the hospital at that moment. So the issue is sorted, the issue is fixed. There was no way that we could have been removing about 800 patients in a big hospital like that one. Actually, it's the first hospital that has demonstrated its capability to handle the issues of COVID-19. I've been there myself, and many other people have been there in that particular area when we were decanting the hospital, creating spaces for such cases. So it came as a surprise on how that issue came about, and it all shocked us, both me and Minister. We thought that these are very serious, huge decisions, of course, respectively, that the issue of inspectors and their the autonomy of the inspectors in doing their work must be kept. It's important and it must be respected. But we thought somehow we don't want to really increase sugar levels of our people around this decision.
Now, Premier, Frere Hospital is a provincial hospital which is used as a referral hospital. Now, when these findings are made in preliminary inspection, surely it should raise alarm. For instance, we spoke to some of the staff there, and they say that some of the patients who have been tested but results have not been released are mixed with people who are negative. How is the provincial government going to curb the spread of this virus if such things continue to happen?
Something that I will definitely have to follow up. I know there's been a lot of stories created around this because of fear and anxiety that has crept in the sector. But it's something that worth following up to ensure that such kind of allegations are really attended to. Anyone who's tested, waiting a result, that person must be actually quarantined to wait for the results. You will only be released if your results are negative. If your results are positive, you're definitely going to be isolated. This is where the issue has been, the issue of self-isolation versus the actually mandatory isolation that we're doing as government in our healthcare facilities. But it's an issue that I can definitely make, but I don't believe so, that there could be such kind of carelessness where PUIs, people under investigations, will actually be mixed. It hasn't happened in a number of hospitals. As that triaging center that is there in the hospital that detects some abnormalities around the issue of suspicions on the certain cases, which always gives us the indication of these people under investigation. Those people are automatically quarantined. They are tested, and that's why we talk about targeted testing. We're looking at that kind of situation. That's why we must actually screen first before we test, so that we are able to balance the work that we're doing, and we're also in line with the national strategy in terms of testing our people.
Okay. I'll keep on referring to the report by the Labour Department. For instance, they said, Chief Inspector Zana said that the hospital was in no condition to be COVID fit, to handle the treatment of the COVID-19 virus. How will that change? How will that be changed by a second inspection?
Actually, that's a provincial inspector. The chief inspector is only in Pretoria, the head office. That's why you appeal. That's why we've said that there's no need for us going to court. If we are disagreeing on certain aspects in terms of how the inspection was done, we can only appeal internally within the department. So that's an issue of dispute between health and them in terms of that, and probably also the language used, because I think it's actually a distortion of facts to even suggest that the hospital is not fit to handle. You can talk about certain aspects within that, those aspects that the department must be instructed to fix. And normally, the Act allows certain days that must be actually given to any client to fix that. So that's what the department was challenging. The department failed to say. We would have actually expecting that if there is something, but we are given a chance to fix those issues if Department of Labour feels like these issues are not in line with standards and norms that are out there. So from where we are, we felt like there are huge gaps on how this issue was handled, and that's why we have said get those inspectors to go back on site today as we speak. They are expected there. Team of health is there, department is there to ensure that we attend to this, and health must fully comply. There is no shortcut around this issue. It is important. It's about safety of our people. It's about safety of the employees. So we've got to make it a point that we don't leave any stone unturned on that particular aspect.
So how many days has the Department of Health been given to fix those problems?
The report I have says on the very same day they were ready. They had a portfolio of evidence to demonstrate, but there was a poor cooperation between the department as well as the inspectors. This is where we had an issue around. Now they are ready. They were ready yesterday, even before we met. They would have been ready even the following day from that day. So that's why we've said, can we just be a bit professional on this issue, go back there, attend to this, have a transparency around this issue so that we don't really get these other funny stories justifying. There's no point for us to justify. These issues must be fixed. And that's a public hospital. It's not just a shop or whatever. It's a public entity that is handling patients who have also constitutional rights, but they must be protected. Government is actually entrusted with that responsibility to look after those patients. So we have said, get it sorted, and today is the day that everything must be sorted. We have given them that deadline, that get everything done according to the law. and the department must comply. We're expecting that to be done. I've been assured also this morning that the team is ready there, everything has been attended to. And we believe that there is no need for court, and the court has been actually pulled out.
But the Labour Department also is in the same page with you as the Provincial Department.
We met with the Minister. We met with the DG. That's the highest authority we have in the department. We were discussing this matter. There was a provincial manager of Labour there. So the issue was that, can we get it sorted in the best legally possible manner that we can? We don't have to go to court to trouble judges about the public interest versus the issues of compliance, etc., etc. So we had to sort that issue ourselves, provide leadership. We are there as Premier and Minister to ensure that we are able to prevail on matters like those without undermining any laws that are there, and we must respect those laws and make everyone to respect those laws. So as I'm standing here, we are equal with the Department of Labour. That process of inspecting must be done, and must be done according to law, with everyone fully complying.
Okay, before I let you go, Premier, the provincial government has been lambasted on its decision to cut travel of bodies between the Western Cape and the Eastern Cape. What does the provincial government have to say about that?
Firstly, there is no decision like that that suggests that people must be buried where they die. So far, there is a discussion that we had in our bilateral with Western Cape, where this issue was raised as another source of unfortunate infection. As you see, our numbers surging every day. That was an issue identified. We were discussing the mitigating factors on how best this issue can be handled. We are not saying that bodies must not be brought home. And our families are in Western Cape. All of us from Eastern Cape, we've got families in Western Cape. People will still be buried where they want to be buried, but the issue must be regulated. And the national was asked, because we were in a meeting with the Minister of COGTA, Minister of Health, and Minister of Police. But some of issues that are happening as we are doing roadblocks, and we are seeing also a lot of criminality around that. So we're saying roadblocks will continue, screening must continue, but we've got to manage a situation where we are also be understanding. Our people in Western Cape, they've got comfort here. They're just looking for a job there. Most of them are staying in informal settlement. There is no way that Eastern Cape will say people from Western Cape cannot come back home, dead or alive. So it's important that that must be clarified and understood. We are discussing it to the best interest of the people here. In our strategy to contain the spread of the virus, all those issues, there will be no holy cows. We are looking at the best possible way to save lives and protect our people. But our people will still be buried where they are comfortable to be buried. Others would want to be buried in Cape Town, others will be buried in Gauteng. Eastern Cape is not only about Western Cape, it's actually interlinked into a number of other provinces. So our relationship with a number of provinces, because we are a labor-sending province, we've got our people all over. So there is no way that we'll say bury in Western Cape but don't bury in Gauteng, etc. So we're looking at this national picture holistically on how best we are dealing with these issues of COVID-19 deaths and actually the transportation of those the mortal remains. So that issue is there. It is a sensitive matter that cannot be just recklessly handled. It was unfortunate that there would have been some very loose comments around that which were based on a perceived decision. There's no actual decision that is talking on that. That's a perceived decision, and there's no decision that's talking on that. It's a matter that government is going to handle with care, is going to engage our people about it when needs arise. There will be a time where a lot of deaths will be coming in. There will not be enough time to have these movements around. So we must be looking at those who are leadership, who are providing that leadership. That foresight leadership is important. But at this point, there is no such a decision. But we are looking at a number of things. We are making even proposals that at some point, the more bodies, because the more people are infected in Western Cape, the more people are dying, and the more of them are buried in Western Cape, that look at other alternative ways to cut the traffic, because the major problem we have is not necessarily on the deceased, the bodies, it's on those who accompany bodies in the form of burial societies, etc. So that's the problem. That's a challenge that we have that we needed to contain and actually minimize as much as we can. Bodies can still be transported even through refrigerated trucks where they will be delivered according to the areas where they're going. So as a province and with the Western Eastern Cape, we are discussing all these protocols within the national guidance and within the national regulations.
Premier, thanks a lot for your time, sir.
Thank you so much.
And that's, of course, the Premier of the province, Mr. Oscar Mabuyane, telling us about the latest on this developing story at Frere, that the hospital will not be closed. In fact, they've tied all loose ends. From us here in East London, Tesri, it's back to you in Joburg.